Fundamentals of Nursing Advanced Questions. Question 1. Why is a precise amount of oxygen necessary for a patient with COPD to prevent which complication? Cardiac arrest related to increased partial pressure of carbon dioxide in arterial blood PaCO2. Circulatory overload due to hypervolemia. Respiratory excitement. Inhibition of the respiratory hypoxic stimulus. In patients with COPD, the respiratory drive is often stimulated by low oxygen levels. Question 2. After 1 week of hospitalization, Mr. Gray develops hypokalemia. Which of the following is the most significant symptom of his disorder? Lethargy. Increased pulse rate and blood pressure. Muscle weakness. Muscle irritability. Muscle weakness is a hallmark symptom of hypokalemia. Question 3. Which of the following interventions promotes patient safety? Assess the patient's ability to ambulate and transfer from a bed to a chair. Demonstrate the signal system to the patient. Check to see that the patient is wearing their identification band. All of the above. All the listed interventions are essential for promoting patient safety. Question 4. Studies have shown that about 40% of patients fall out of bed despite the use of side rails. This has led to which of the following conclusions? Side rails are ineffective. Side rails should not be used. Side rails are a deterrent that prevents a patient from falling out of bed. Side rails are a reminder to a patient not to get out of bed. The correct answer is D, because side rails primarily function as a cognitive and physical reminder to patients, discouraging them from attempting to get out of bed without assistance. Question 5. Examples of patients suffering from impaired awareness include all of the following except a semiconscious or overfatigued patient, a disoriented or confused patient, a patient who cannot care for themselves at home, a patient demonstrating symptoms of drug or alcohol withdrawal. Patients with impaired awareness may exhibit symptoms such as being semiconscious, overfatigued, disoriented, confused, or demonstrating symptoms of drug or alcohol withdrawal. Question 6. What is the most common injury among elderly persons? Atherosclerotic changes in the blood vessels. Increased incidence of gallbladder disease. Urinary tract infection. Hip fracture. Hip fracture is the most common injury among elderly persons. Question 7. What is the most common psychogenic disorder among elderly individuals? Depression. Sleep disturbances, e.g. bizarre dreams. Inability to concentrate. Decreased appetite. Depression is the most common psychogenic disorder among elderly individuals. Question 8. Which of the following vascular system changes result from aging? Increased peripheral resistance of the blood vessels. Decreased blood flow. Increased workload of the left ventricle. All of the above. As individuals age, various changes occur in the vascular system. Question 9. What is the most common cause of dementia among elderly persons? Parkinson's disease. Multiple sclerosis. Amyotrophic lateral sclerosis, Lou Gehrig's disease. Alzheimer's disease. Alzheimer's disease is the most common cause of dementia among elderly persons. Question 10. What is the most important legal responsibility for the healthcare team after a patient's death in a hospital? Obtaining consent for an autopsy. Notifying the coroner or medical examiner. Labeling the body appropriately. Ensuring the attending physician issues the death certificate. After a patient's death in a hospital, the most crucial legal responsibility for the healthcare team is ensuring that the attending physician issues the death certificate. Question 11. Before rigor mortis occurs, what is the nurse responsible for? Providing a complete bath and dressing change. Placing one pillow under the body's head and shoulders. Removing the body's clothing and wrapping the body in a shroud. Allowing the body to relax normally. Before rigor mortis occurs, it is essential to place a pillow under the body's head and shoulders to maintain proper positioning. Question 12. During a seizure, what is the primary intervention? Protect the patient from injury. Insert an airway. Elevate the head of the bed. Withdraw all pain medications. The primary intervention during a seizure is to protect the patient from injury. Question 13. According to the principles of standard precautions, when should gloves be worn by healthcare providers? Providing a back massage. Feeding a client. Providing hair care. Providing oral hygiene. The correct answer is D, providing oral hygiene, because standard precautions mandate glove use during procedures involving contact with mucous membranes, non-intact skin, or potential exposure to bodily fluids. Question 14. The healthcare professional is preparing to take vital signs in an alert client admitted to the hospital with dehydration secondary to vomiting and diarrhea. What is the best method used to assess the client's temperature? Oral, axillary, radial, heat-sensitive tape. The most accurate method for assessing temperature in an alert client is the oral method. Question 15. A nurse obtained a client's pulse and found the rate to be above normal. The nurse documents this finding as tachypnea, hyperpyrexia, arrhythmia, tachycardia. When a nurse finds a client's pulse rate to be above normal, it is documented as tachycardia. Question 16. Which of the following actions should be taken to use a wide base support when assisting a client to get up in a chair? Bend at the waist and place arms under the client's arms and lift. Face the client, bend knees and place hands on the client's forearm and lift. Spread the feet apart. Tighten the pelvic muscles. When assisting a client to get up in a chair, it is essential to use a wide base of support to maintain stability and prevent injuries. Question 17. A client had oral surgery following a motor vehicle accident. The nurse assessing the client finds the skin flushed and warm. Which of the following would be the best method to take the client's body temperature? Oral, axillary, arterial line, rectal. In cases where the oral route is not recommended due to oral surgery or altered consciousness, the rectal method is preferred for the most accurate body temperature reading. Question 18. A client who is unconscious needs frequent mouth care. When performing mouth care, what is the best position for the client? Fowler's position, side-lying, supine, Trendelenburg. When providing mouth care to an unconscious client, the side-lying position is the best choice. Question 19. During a client's first hospitalization, which of the following actions ensures the safety of the client? Keep unnecessary furniture out of the way. Keep the lights on at all times. Keep side rails up at all times. Keep all equipment out of view. During a client's first hospitalization, it is essential to keep unnecessary furniture out of the way to prevent obstacles and ensure a safe environment. Question 20. After a walk-in client enters the clinic with a chief complaint of abdominal pain and diarrhea, the nurse takes the client's vital signs. What phase of the nursing process is being implemented by the nurse? Assessment, diagnosis, planning, implementation. In this scenario, the nurse is performing the assessment phase of the nursing process. Question 21. Which term is best described as a systematic rational method of planning and providing nursing care for individuals, families, groups, and communities? Assessment, nursing process, diagnosis, implementation. The nursing process is a systematic rational method that guides nurses in planning and delivering patient care. Question 22. In which of the following organs does the exchange of gases take place? Kidneys, lungs, liver, heart. The exchange of gases, specifically oxygen and carbon dioxide, occurs in the lungs. Question 23. Which chamber of the heart receives oxygenated blood from the lungs? Left atrium, right atrium, left ventricle, right ventricle. The left atrium is the correct answer because it is the chamber of the heart specifically designed to receive oxygenated blood returning from the lungs via the pulmonary veins. Question 24. What is a muscular enlarged pouch or sac that lies slightly to the left and is used for the temporary storage of food? Gallbladder, urinary bladder, stomach, lungs. The stomach is the correct answer because it is a muscular J-shaped organ located in the upper left quadrant of the abdomen, specifically designed for the temporary storage and digestion of food. Question 25. What is the term for the body's ability to defend itself against specific invading agents such as bacteria, toxins, viruses, and foreign bodies? Hormones, secretion, immunity, glands. The correct choice is C, immunity, because it directly refers to the body's complex defense mechanism that recognizes and combats specific pathogens like bacteria, viruses, toxins, and foreign bodies.